Heart failure means that the heart is unable to pump blood around the body properly. It usually happens because the heart has become too weak or stiff. Coronary artery disease is the medical name for the narrowing of the heart arteries, and it's the most common cause of heart failure. Identifying it can help us to decide how we treat heart failure. 3 main tests are commonly used to identify coronary artery disease in patients with heart failure, but we don't know which of these tests are best for patients. We're hoping to find out which is best with this research. We're asking 3,000 people across the UK to take part in our research. People taking part in the study will be randomly assigned one of the 3 tests. All 3 tests are standard care in the NHS, and so people taking part in the research will not be exposed to any experimental procedures. People in Group 1 will get an invasive coronary angiogram. This is the test most commonly used to identify coronary heart disease. In this procedure, patients will have a local anaesthetic injection. This will be in the wrist or groin. The doctor will pass a catheter, a thin, flexible tube, into an artery, and then directly to the heart. Contrast dye is injected directly into the heart arteries, and multiple X-ray pictures are taken. The patient will usually be awake. They'll be able to talk to the medical team throughout the procedure. People in Group 2 will get a stress MRI test. People taking this test lie in a short tunnel inside a scanner. During the scan, they will have an injection of MRI contrast medication. They will also be given a medicine called adenosine. This medicine increases the blood flow to your heart during the test. Sometimes patients can find this a little claustrophobic. If that happens, they can be given a small dose of sedative. People in Group 3 will get a CT coronary angiogram. CT stands for computerized tomography, and this is an advanced type of X-ray. People having the test lie on a bed inside a scanner. They receive an injection into a vein in their arm. The injection is a contrast dye. The dye shows the heart arteries in the CT coronary angiogram. People having the test may also receive medicine called a beta blocker. This is given to slow their heart rate down a little. Whichever test you have, the scan will be reviewed by a consultant in the normal way, and this will be at your local hospital. Your own cardiologist will decide upon the best treatment for you, and your treatment will not be altered if you take part in this study. We've designed this study to minimise inconvenience to patients, and participation does not require any additional visits to hospital. The research team will need your permission to access your medical records. They will only use information that they need and will keep your data safe and secure, following strict privacy rules. You will be invited to fill in simple health questionnaires when you join the study, after 6 months, and at 12 months. The questionnaires can be done remotely via telephone, post, or email. Each questionnaire should take no longer than 20 minutes to complete each time. We know that people from ethnic minorities in the UK are more affected by coronary artery disease and heart failure. However, they've not been sufficiently included in previous research. We want to encourage more patients from different backgrounds to be part of this research. That way, the results of the research will apply to patients from all communities and ethnicities. Thank you for thinking about joining this research.